Hello everyone, myself Dr. Deptee Warikoo, Department of Physiotherapy, Dolphin PG Institute of Biomedical and Natural Sciences. Our today's topic is suctioning. Suctioning is basically mechanical aspiration of pulmonary secretions. So this is aspiration of those pulmonary secretions from a patient with an artificial airway in place. The procedure involves you have to prepare the patient and then use the suctioning devices. It is mainly used to clear retained or excessive lower respiratory tract secretions. It is done in those patients who are unable to do that themselves. This could be due to the presence of any artificial airway such as endotracheal or tracheostomy tube, or in patients who have a poor cough due to an array of reasons such as excessive sedations or any kind of neurological involvement. Having an artificial airway in situ impairs the cough reflex and may increase mucus production. Therefore, in the neonatal and pediatric ICU, suctioning of an artificial airway is likely to be the most common procedure. Mainly we do it in oropharyngeal or nasopharyngeal techniques. These suctioning techniques, the oropharyngeal and nasopharyngeal technique, are intended to stimulate a cough to remove excessive secretions and to aspirate secretions from the airways that cannot be removed from the patient himself. A cough may be stimulated by a catheter in the pharynx or by passing a catheter between the vocal cords and into the trachea to stimulate the cough. This we will see in later slides. This is also termed as nasopharyngeal suctioning. The trachea is accessed by insertion of a suction catheter either via the nasal passage and the pharynx, which is the nasotracheal suction, or via the oral cavity and the pharynx, which is called as orotracheal suctioning. Nasotracheal suctioning may be undertaken directly via the nostrils. However, in some situations where repeated suction is needed, we could use other nasopharyngeal airways. Secretions are removed by the application of subatmospheric pressure via wall mounted suction apparatus, which we will be seeing in the practical sessions. So now when we talk about the main indications of these suctioning technique, we could use it in a therapeutic manner as well as in a diagnostic manner. When we talk about therapeutic manner, the indications could be coarse breath sounds, noisy breathing. You can all auscultate it with stethoscope. Visible secretions in the airways via the X-rays, decreased SpO2 in the pulse oximeter, and deterioration of arterial blood gas values. Clinically increased work of breathing, patient is very inefficient to perform proper breathing. Suspected aspirations of gastric or upper airway secretions, patient's inability to generate an effective spontaneous cough, any changes in the monitored flow pressure graphics, or if there is increased PIP. X-ray changes, if you see like secretions retained or consistent secretions, the need to maintain the patency and integrity of the artificial airways, also at that time we can use suctioning. The need to stimulate a cough in the patient, and the presence of pulmonary atelectasis or consolidations presumed to be associated with secretion retention. Matlab secretion is not coming out properly as it should be. Some special procedures like bronchoscopy and endoscopy may also need regular suctioning. Another type is the diagnostic. In the diagnostic, the indications could be the need to obtain a sputum specimen in the patients who are already going through endotracheal aspirations. For bacteriological or microbiological or cytological investigations, you can use suctioning. Here in this picture you could see we are using the suctioning device to collect the sample. Now there are some terminologies which will be very effectively used, like first is the airway suctioning. Airway suctioning is the removal of airway secretions or any foreign materials by artificial means using an applied negative pressure. Then you can see Yankovic suctioning catheter, a rigid suctioning tip used to aspirate secretions from the oropharynx. Then oropharyngeal suctioning requires the use of an airway adjunct. Then nasopharyngeal suctioning, it may be undertaken directly via the nostrils without any airway adjunct. If repeated suction is anticipated, a nasopharyngeal airway should be utilized. This is inserted only by those that are trained to do so. Suction is an invasive procedure and should not be carried out on a routine basis. That you have to make sure that you understand properly. After these terminologies, let us see what are the basic types, two systems and the types of suctioning. We can use, in the pictures you can see, we can use, this is an open suctioning method and this is a closed suctioning method. There are the two basic types of suctioning, closed suctioning and open suctioning. So the first we can see, this is the loop of the closed suctioning system. This do not disconnect from the ventilator. Similar procedure to open technique, but no application of sterile glove is used. It enables a clinician to clear the lungs of secretion whilst maintaining ventilation and minimizing contamination with least possible disruption to the patient. It is very helpful in preventing cross-contamination and infection. Next is the open sterile technique. Here cleaning the airways of a mechanically ventilated patient is done with a suctioning catheter inserted into the endotracheal tube after the patient has been disconnected from the ventilator circuit. We should know that both the techniques could be used. Both the techniques do not have any effect on the risk of ventilator associated pneumonia or mortality. So we can use both the techniques, either open sterile technique or a closed technique. Both the techniques are well useful. After that, let us see how we will start the suctioning. First we will assess. Qualified personnel should assess the need for tracheal suctioning as a routine part of patient ventilator system check. So first you should take a proper person who knows how to perform suctioning properly. Then what are the equipments which are mainly used for suctioning? First, vacuum source with adjustable regulator suctioning jar. Then a stethoscope to auscultate. Sterile gloves for open suctioning method. Clean gloves for closed suctioning method. Catheters, sterile catheters. Clear protective goggles, apron and mask. Sterile normal saline. Bind circuit or ambu bag is very important for pre-oxygenate the patient. Then suctioning tray with hot water for flushing. Then you will monitor the patient. What all things we need to monitor while performing the suctioning technique? First, the breath sounds. I have already told you, no coarse breath sounds should be there. Oxygen saturation, respiratory rate and pattern, hemodynamic parameters like pulse rate, blood pressure, cough effort, then ICP, then sputum characteristics. You have to evaluate and monitor sputum, the color, the volume, consistency and the odor. This I have already told you. Then other ventilator parameters like PIP, FiO2, these things have to be monitored properly. Now you have to prepare the patient for the suctioning. Explain the procedure to the patient if the patient is conscious. If not, then you should perform it in well guidance. The patient should receive hyperoxygenation by the delivery of 100% oxygen for more than 30 seconds prior to the suctioning. Position the patient in supine position and auscultate the breath sounds. Perform this properly before suctioning. This is very important. You should perform it properly before suctioning. Then perform hand hygiene. Wash hands properly. This reduces the transmission of any infection or microorganisms via the suctioning device. Turn on suction apparatus and set the vacuum regulator to appropriate negative pressure. For adult, a pressure of 100 to 120 mmHg should be recommended. 80 to 100 mmHg for children and 60 to 80 mmHg for infants. This is very important that you know how much pressure has to be set on the suction apparatus. It is very important. So please do remember before performing the suction about the accurate pressure to be given while performing the procedure. Goggles, mask and apron should be worn to prevent splash from secretions. Pre-oxygenate with 100% of oxygen. Open the end of the suction catheter, package and connect it to the suction tubing. Wear sterile gloves with sterile technique. With the help of an assistant, open suction catheter package and connect it to the suction tubing. With the help of an assistant, disconnect the ventilator, kink the suction tube and insert the catheter into the ET tube until resistance is felt. Do it properly with proper guidance and with proper technique. Resistance is felt when the catheter impacts the carina or bronchial mucosa. The suction catheter should be withdrawn 1 centimeter out before applying the suction. Remember this properly. Apply continuous suction while rotating the suction catheter during removal. The duration of each suction should be less than 15 seconds. Instill 3 to 5 ml of sterile normal saline into the artificial airway if required. Assistant resumes the ventilator again as you perform this. Give 4 to 5 manual breaths with a bag, ambu bag you can use or ventilator. Anything you can use to give manual breaths. This you have to perform properly. Then place the dominant thumb over the control vent of the suctioning port. Apply continuous or intermittent suctioning for no more than 10 seconds as you withdraw the catheter into the sterile sleeve of the closed suctioning device. Repeat steps above if needed. Okay, and clean suction catheter with sterile saline until clear, being careful not to instill solution into the ET tube. Suction oropharynx above the artificial airways and then wash your hands properly. Then you have to do few techniques along. One could be stimulating a cough. During an assisted cough, the physiotherapist applies pressure, in which you can see in the diagram, to the chest wall in synchrony with the patient's cough in order to increase the peak expiratory flow rate, that is PEFR. The two common methods could be an inward pressure applied to the lower lateral ribs or an AP pressure applied to the upper anterior chest wall. Any two things you could be using. If the patient does not have a strong, effective, spontaneous cough, several methods could also be used. We can use tracheal rub, we can use catheter stimulation in oropharynx. You can use any method. Here you could see the first way. This is the tracheal rub. The physiotherapist is using a finger or thumb to rub using blunt pressure across the trachea, just above the suprasternal notch. This is called as tracheal rub. Next, catheter stimulation of a cough. A cough can be stimulated by inserting the tip of the catheter along the outside of the teeth and around into the back of the oropharynx. As the catheter is passed along the side of the teeth, a block is commonly felt when the catheter comes in contact with the mandible. Then you keep rotating the catheter gently. This will allow the catheter to move off the mandible and into the back of the oropharynx, where you could stimulate the cuff. But avoid passing the catheter directly over the tongue. This could stimulate the gag reflex. If successful, this technique may prevent the need of suctioning via the nasopharyngeal airways. So this is one important way. Now we can use various types of catheters, suctioning catheters. In suctioning, we could have various colors which will tell us the size of the catheter. Like blue will have a size 6, black 8, white will have 10, green 12, yellow 14, orange 16 and red 18. For infants, we always use a blue color catheter. Children, we could use black and white catheter. Green, yellow, orange and red is used for adults. Here you could see this is a picture of catheters. Various, you can see red, white, green, blue catheters. This is the tip of the catheter. Now how to choose? External diameter of the suctioning catheter should be less than half the diameter of your endotracheal tube. So first you see what is the diameter of your endotracheal tube. On the basis of that you will decide what size of catheter you are going to use. So endotracheal tube, we will have various size and diameters of endotracheal tube. For males we mainly use 8 mm's and for females we use 7.5 mm's. For newborn till 3 months we use 3 mm's. For 3 to 9 months we use 3.5, 9 to 18 months 4, about 2 years till 6 years we can use anything between 3 to 4, and after 6 years you could use anything above 4. So this you could see is the diagram of an endotracheal tube. इसी में आपको अपना suctioning catheter जो है वो insert करना है. Now there could be lot of complications of your suctioning which you have to make sure you know before performing the suctioning, like infection, hypoxemia, erythema, hypotension, lung collapse. So to avoid these, do a proper assessment of the outcome and check if the suctioning you are performing is having a good impact on your breath sounds. It is decreasing the peak inspiratory pressure. Increased tidal volumes could be seen delivery during the ventilation. You could see improvement in the arterial blood gas values or saturation as reflected by pulse oximeter. And you could also see after suctioning removal of the pulmonary secretions increase. There could be lot of contraindications. Most contraindications are relative to the patient's risk of developing adverse reactions. Suctioning is mainly contraindicated when there is fresh bleeding. When indicated, there is no absolute contraindication to endotracheal suctioning because the decision to abstain from suctioning in order to avoid a possible adverse reaction may in the fact be lethal to the patient. So complications which we have to make sure are not there are trauma, bleeding, vomiting, transient bradycardia, laryngospasm, airway obstructions, intracranial placements, migration of the airway, epistaxis, stimulation of the gag reflex, stimulation of the biting reflex or any dental trauma. We have to make sure we are taking care of precautions. Precautions have to be maintained very properly before and while giving suctioning. There are bleeding risks, so give suctioning in proper manner. There could be hemodynamic instability, hemoptysis, acute face, neck or head injury, septal deviations. You could see lots of things in which you have to make sure suction is giving very properly, like in children if there are false teeth, there are recent oral surgery. So make sure these precautions are taken care before performing the suctioning. There are some limitations to the method. Suctioning is potentially harmful procedure if carried out improperly. So you need to be properly trained before giving suctioning. Suctioning should be done with clinically necessary, not routinely, and the need of suctioning should be assessed at least every 2 hours or more frequently. So not given before assessment. If needed, then only given, and given by the proper trained clinician. These are the basic principles you have to make sure you maintain while giving the suctioning. So this was about the suctioning. If anybody has any doubt, you can ask me, message me, or WhatsApp me. Thank you. See you all in the next class. We will be dealing with oropharyngeal suctioning and nasopharyngeal suctioning in the next classes. Thank you.